Welcome back to Rural Health News, the segment of Rural Health Today where we fill you in on the latest in rural healthcare headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. If Congress cuts funding to Medicaid, the impact will be more significant than any other healthcare issue we've seen in decades. The past few weeks, we've discussed the importance of Medicaid for the country's access to healthcare, but we're truly just scratching the surface. Let's look deeper. Medicaid cuts will lead to the closure of many rural hospitals in the U.S. This is confirmed by many studies, many surveys, and many experts who have looked at the data. This will result in longer drives to hospitals for those communities, and understaffed hospitals due to a lack of fiscal stability, and overcrowded emergency rooms and waiting lists. Well, let's not forget about emergency medical services. Our local EMS will also experience shortages and closures because Medicaid is a primary funder of this industry, leaving the surviving companies to cover wider service territories, and many communities will be without any kind of EMS services. Every second matters when a loved one has an emergency. If we're expanding healthcare deserts and making it impossible for the emergency medicine industry to function in rural areas, healthcare outcomes will suffer and mortality rates will increase. The brutal reality is this: without funding for programs like Medicaid, and we're talking about appropriate funding to cover the cost of services, rural healthcare cannot and will not advance, let alone survive. On to the damage report. Earlier this month, 23 states and the District of Columbia filed a lawsuit against Health and Human Services for canceling billions of dollars in public health grants. The suit called the termination of funds abrupt and arbitrary, claiming state health departments were relying on the promised grants to meet urgent public health needs, including infectious disease prevention, immunization access, emergency preparedness, and mental health services, as well as opioid addiction treatment. The funding cuts will result in many job eliminations, which is evident in the hundreds of employees already being laid off by state health departments. The cuts will lead to severe lack of preparedness for otherwise preventable disease, the suit says. According to the Health and Human Services, the reason for the termination of the grants was the ending of COVID-19 pandemic, but when authorizing the grants, Congress approved state allocation of funds to address other public health concerns, and some of the funding was not set to expire until July of 2027. State health departments were not given adequate notice and the chance to appeal the cuts, and the fact provided the basis for a federal judge to temporarily bar the funding cuts, despite the request from the Department of Justice for more time to review the thousands of pages of exhibits listed in the lawsuit. Lastly, for our damage report, we'll review the impact of new tariffs on healthcare. One of the most concerning is the 25% tariff on steel and aluminum imports, which are essential to the production of medical devices and supplies. The disruption of the medical supply chain will have a direct impact on the ability of hospitals and healthcare organizations to care for their patients. Rising supplies and pharmaceutical costs will only contribute to the current financial turmoil hospitals face today, especially in rural areas. And now for today's success story. Despite the reigning negativity of current healthcare events, good news is still out there. We can find it, folks. We just have to look a little harder. According to a survey by Athena Health, physician satisfaction has improved in the last year. The number of physicians thinking about leaving their field has actually dropped by 22%, and more than half of the physicians report better work experiences. The results also indicate decreased administrative burden due to AI, although regulatory requirements and financial health remain a significant concern for our physicians. And thank you to our sources for this episode: Med City News, Becker Hospital Review, the New York Times, New York State Attorney General, The Hill, and Business Wire.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.